So let us see what happens. So CSP, that means the cloud storage service provider, will keep metadata about the patient, because you see the important thing is that since Dr. 1 may be asking for patient 1, Dr. 2 may be asking for patient 2, but we will not have patient information up in the open, right? They are secured. Okay, so the CSP must have a way to find out whose information is this. If it is Dr. 1 asking for the information, then only patient 1's information should be retrieved. That means that way the information should travel, the query should travel. So there is metadata information about the patient, not only the patient but also maybe the storage where this patient's information is kept. So we are going for homomorphic encryption techniques, but mind you that these homomorphic encryption techniques are not the one that are already available. We have already implemented, which is not actually in these slides because of paucity of times. It's that we have marked the different portions of the patient information and encrypted each of the portions differently, and each of these keys are with the relevant either health workers or doctors or the patients, and whoever requires whatever information is covered within that portion and the key. And another important thing is that new data of the same patient has to be appended to the same existing data. So this is very important, so that no format data gets deleted, only appending may be done, and obviously it should be updated also. Now comes the data retrieval part. That means suppose the doctor is asking for the data. So the query posted by the user is first encrypted. The query itself will also be encrypted because this is health information, that is why. So that no one in the middle could attack it. So it will be encrypted, and the CSP then sends the encrypted query to the SP. But remember always that even before this, whoever has posted the query, the user has to be authenticated first. Okay, so that part will always be done, then only this second part comes. And then the response generated by the SP will again be encrypted using some key which is called the retrieval key, and it will send the encrypted result of the query to the CSP, and the CSP will provide the response to the user. But here actually the main thrust of our task is to identify which information may be required by whom and when, and many a time it may be required that suppose I was thinking that okay, doctor may know the history information at first, but maybe the doctor has forgotten something, so he may at a later point of time again refer back to the history information of the patient. So that particular access should also be given at that point of time. So there are these dynamics in the environment which need to be tackled very importantly. I mean, this is a very, very important aspect of this work. So the security and why mobile cloud computing, that I must say that because the doctor may want to look it up from any of the devices, whether it is his or her mobile device or he is sitting at a chamber, so provisions for everything should be kept. And also the health workers will be working, they will be going to villages, and we have in our future plan maybe that the white cloud, because maybe we are thinking that the patient may be wearing different types of sensor devices, and that is a body area network, as you know, and the doctor sitting on the other side may try to acquire that body area network as a resource of the cloud. So that is why we have gone for this mobile cloud computing based services. So here the protocol suite is proposed that covers the security aspects of the entire system, and remote mission monitoring is required in cases. I have come from India, you know, that where a patient is unable to move and the doctor cannot also reach the patient very frequently because the health centers may be far away from his home. So that facility is, you can say, mostly unavailable. And patient data being in cloud facilitates the doctor to access it as and when required, and immediately take action, and we, as a part of our project, which we have already implemented in at least 2 of the kiosks in West Bengal, India, that the doctors are really sitting at Calcutta, and patients are in the villages, and they are many a times they are real time also. That means the patients are also there, the doctors are also there, so they are having, a good feedback from the doctors and so on. So that is what I wish to share with you. This is part of our research project, and these are some of the references. Other references are in the paper. So thank you all for your patience.